Hi, I'm Emma, a pre-doctoral fellow based at Newcastle University in Fuse. Over the next few minutes, I'm going to tell you a little bit about a study that I'm leading. I wanted to start off with a story. A year ago, Andy was living in council housing with his dad. When the initial lockdown started, he was scared, but he knew with his dad by his side, everything was going to be okay. Things quickly took a turn for the worst when Andy's dad passed away in the summer. Before he knew it, he was being kicked out of the place he had called home. Andy had become homeless. He hopped from couch to couch, but ended up in a hostel, and it wasn't like anything he could have expected. Andy felt completely alone, and he started to drink to cope with all of his grief and anxiety, and he found he was becoming more depressed. Andy didn't know what support was available, and he didn't know how to access it. If you were in Andy's shoes, would you know how to access support? This is what my research looks to understand. I'm currently exploring how individuals who experience homelessness access or don't access mental health and addiction support within their community during the COVID-19 pandemic. Being a first-time principal investigator, I spent a large amount of time over the last year learning from a lot of firsts, successes, and missteps. I was able to leverage existing partnerships and research expertise to submit a bid fairly early on, and I've spent a lot of time navigating how to deliver that within the constraints of COVID. From the start, partnerships were always essential to the success of this study, and I've continued to develop my network within the region, and it's these relationships that have enabled me to continue recruitment despite the fact I haven't been able to see anyone face to face. Through working with individuals with lived experience, I've been able to navigate the digital divide and make sure those I'm most interested in speaking to are not being excluded from my study. Although that's just a high-level snapshot of some of the things I've learned being a principal investigator, I think it's important to note the study's ongoing and I still have a lot to learn. One of the things I'm currently doing is looking for creative ways to share the findings. What we did was we asked participants what they think could have been done differently to improve access to support. Claire explains for her, the key is getting out into the hostels and knocking on doors and saying, "This is what we're offering for a service, and would you like to be involved in it?" You're not aware. You get put here and sitting, waiting for something to happen, but nothing ever happens. Through understanding the experiences of folks like Andy and Claire, we're hopeful that our results will improve how support responds in future times of crisis. Thank you for listening, and if you'd like to learn more, come visit me at my virtual booth on May 13th.